और लाइक बहुत सारे पेशेंट्स को ये भी लगता है कि मैं शॉर्टकट अपना लूं, मतलब I'll eat Ozempic or some magical pills and they will reduce the weight and नहीं करवानी surgery. So like what are your views on that? And any case study which came to you, like उन्होंने they have consumed these kind of pills?
I get at least 1 to 2 patients every day who would want shortcuts. Everyone wants a bank balance like Ambani's and Tata's, but they don't want to work. They don't understand that Tata's took almost a century to reach where they are.
Correct.
Right? They all started small, slow. Right? So consistency is the key. Learning and growing is the key. Now, very recently, there's a lady who came to me and from Delhi, and she showed me, sir, after discussing, sir, मेरे को surgery नहीं करानी. मैंने कहा that's perfectly okay. And मैं सर ये वाली drugs ले रही हूँ. And she showed me two boxes, 2 jars.
अच्छा.
And I saw them, and one was from the US, one was from the UK. And I said, you're taking this? She says, yes. I said, who got you this? She says, one of my GPs told me to get it, and this is, I got from UK, and this is almost $300, and this is almost 250 pounds, and so forth. I said, did you even go through the ingredients yourself? She said, no, I was told. I said, you were told. Have you just read what is on the bottle? The bottle said, for experimental use only, not meant for human consumption.
And she was consuming it.
The bottle label itself said,
that is so sad.
an educated person from New Delhi. I said, you guys must be nuts. This bottle says and you're still taking it. And I said, you know what? Can I please make a reel right now? I won't show you face. I just want to tell people, don't do this to yourself. Don't do it to yourself. But yeah, she refused, but that's okay. So coming back to these so-called magical weight
pills.
So there's nothing called magical pills.
Okay.
These drugs primarily were made for diabetes, control of type 2 diabetes.
Okay.
And it also showed some amount of weight loss.
Okay.
So of lately they have been used for obesity, primarily for class 1 with diabetes.
Okay.
A very few of class 2 with diabetes, not purely for obesity. The results are equivocal. It has to be only under supervision. They are filthy expensive, not always freely available. Plus they come with side effects. They come with serious side effects. One of the latest, there was a newspaper in US, about 2% people, I'm not 100% right, 2% or 2.5% people lost their eyesight.
Because of these pills?
Because of these GLP analogs, right? Which is a huge number.
Yes.
Huge number, right? So you have to be extremely careful. And if you think that you must take it, please go through the literature of this.
Exactly.
Once you go through it, it will tell you that serious retinal detachment, serious effect on the heart, serious effect on the kidneys can be there. So trying to lose weight just because you want a shortcut, you got money you can spend and you want to take shots is extremely dangerous for you. It's extremely foolish. I would not suggest anyone to do it, right? And so pharma companies are, of course, coming up with newer things.
Exactly.
They just gave an ad in the paper, almost a half-page ad, that they are worried about obesity. I'm not sure if they are worried about obesity or trying to sell the drugs. So my advice to everyone watching is like, please don't look for shortcuts. There are no magical drugs. Exercise, diet, and in a very, very, very select few people, these drugs can be useful. Do I use it? Yes. Do I use it on my patient? Yes. For extremely select group of patients under supervision, they have to come and see me. We need to do a blood investigation. We need to see their eyes, their kidneys, their heart, and everything. Achha. So select group of people, yes. For everyone, no.
And what test you recommend to the patient, like before coming for a bariatric surgery?
A lot of tests. There is the whole battery of investigation. All blood tests, the eye tests, the heart, the echo, the DSE, the Doppler, kidney test, respiratory test, endoscopy, ultrasound, and so forth. I mean, we have to see the patient wholesomely before we even subject the patient for surgery.
Okay. And I think like in a family where everyone is obese, one person taking one step towards having a healthier life is something like breaking the chain.
Oh, absolutely. I have families altogether in which I've operated everyone.
Achha.
Everyone. The husband, wife, both the kids.
Wow.
Right. The wife, husband, all the kids. 2 siblings, both them operated. Husband, and then later he got married, the wife got operated, right? Achha. So I have many families like that because obesity has a familial trend. So you
Correct.
will see a lot of people working in the or living in the same family and getting obese and so getting operated.
And the recent study I was reading, and it was showing like the separation and the divorces are happening because of the obesity. Even like people are not able to conceive.
Oh yes, infertility,
Because,
as I said,
yeah.
infertility is a big issue in obesity. I think one of the forerunners of infertility in males is obesity. Even in females is infertility. And you know what happens if one of the partner is obese? The likelihood of the other partner being obese is much more.
Exactly.
Right.
Yeah.
So then both are subfertile. So the chances of infertility becomes higher. And we have very many. I mean, there's this one girl, and I call her my daughter, and she was having primary infertility, and now after 10 years of marriage, she just had a baby.
Oh wow.
Yeah. So
That is
and I
sweet.
call her, that's मेरे को नानू बना दिया उसने, and I'm extremely proud, and she's doing extremely well. So infertility is a big problem in obesity.
So there's a show like, Shed My Pounds, and this is by TLC. So I was watching it the other day. What do you think, like these kind of shows are actually helping people or they are harming people more?
So I've just seen I just seen a very short glimpse of it sometime. I mean, I'm not really following that show, but I saw this lady, I think, who was about 600 pounds odd, and she was talking about how her life was before and after surgery. So I think for super obese people, I think it's a good thing, because they will know that there is still some amount of light at the end of the tunnel. So they know there is a process wherein they can be okay.
Right.
So I think it's a good thing. And would it be successful in converting a lot of patients? I do not know. But at least for people who are fighting obesity and who are super morbidly obese, for them, at least they know that if someone has done it, probably they can do it too. So I think it is good to be aware. And of course, I think if they're doing it rightfully, so it is spreading awareness about solutions of obesity, so which is a good thing, I think.
But वो acceptance कैसे आएगा उनमें? जैसे like in the starting you said कि patients should accept it. तो वो acceptance कैसे आएगा? Like by watching these kind of shows or scrolling an Instagram reel?
So you know what? I think most of them are in denial mode. It is not acceptance. They are in denial. I'm okay. I am okay. थोड़ा सा heavy हूँ, but मैं ठीक हूँ. मैं अच्छा हूँ. मैं भाग सकता हूँ. So over a period of time, disease start to kick in. They can't walk. Stairs पे चढ़ते थक जाते हैं. Laces नहीं बांध सकते. एयरक्राफ्ट के इकोनॉमी में बैठ नहीं सकते. एयरक्राफ्ट की बेल्ट नहीं आती. एक्स्ट्रा बेल्ट मांगनी पड़ती है. अपने साइज के कपड़े नहीं मिलते. बच्चों के पेरेंट टीचर मीटिंग में नहीं जा पाते. Right? So everyone is getting aware, and now over the last 2 decades, I would say, people are getting aware, and people do come for consultations at least.
So as we are coming to the end of the podcast, so like can you tell me what these healthcare aggregators or like Practo, Pristine Care, how they are different from like the practice which we are doing in our hospital or the clinic?
So I would not want to name any. So there are n number of aggregators,
Exactly.
and so God bless them. However, what I tell everyone is that, you know what, when you go to a surgeon, right, when you go to a bigger corporate hospital or a tertiary care hospital, you must know that you're going to someone responsible.
हाँ जी.
Right?
Right.
You are going to a brand itself, right? And it takes a lot to become a brand.
Correct.
Right?
Correct.
Plus, you are going to someone who has been into practice for some time. It is not that to save that extra money, you will be seen by someone else, operated by someone else, in a third place, post-operatively seen by a fourth person. So there is no way of, you are not one person's responsibility.
Correct.
It's your health. It's your health.
Right.
Right? हम अपने बच्चों की एजुकेशन में इतना केयरफुल हो जाते हैं, तो हेल्थ में इतना केयरफुल क्यों नहीं हो सकते? सो कुछ पैसे बचाने के लिए, कुछ सस्ता करने के लिए, I don't think so it's a brilliant idea. Maybe a few of their surgeons are doing brilliant job. I do not know. Maybe they are doing brilliant job. But going to someone else who has advertised, who will take you to one more surgeon whom you've never heard of, to a third place you're not aware of. So sense of responsibility and sense of, because I have seen a few patients wherein they were operated, they said, हमें उसका सर्जन वो मिले ही नहीं कभी, हमें कोई और देखता है. So तो कोई answerability नहीं बची ना. Or surgery, and especially bariatric surgery, weight loss surgery is not something that you can go to any person and get it done. You need, as I said, surgery is only 10%. अब वो 10% भी अगर आपका कंप्लीट नहीं है, किसी ने करी, किसी ने देखा, किसी ने फॉलो अप किया, तो 90% कौन करेगा आपका?
So there's the process of 90% of post-operative got
तो फिर वो चला ही गया. So I don't think so. It's a brilliant idea, but saying that they are doing bad job, I do not know. A few of them may be doing brilliant job. I do not know. So I don't want to condemn anyone, but I would say for patients, it's important to research and search the surgeon, the place. Is it been done frequently there? Is the surgeon doing frequent work? How is their follow-up? And that is most important to search.
And 5 से 10 साल के results भी देख लो, ताकि like you know, like this is a surgeon whose expertise is bariatric. So how do you see the future of bariatric surgery and robotic?
So bariatric is here to stay, and some people were talking about that once these drugs are there, so surgery कम हो जाएगी. I don't think so, because there, it's like saying क्योंकि टोयोटा ने ये कार बना दी, रोल्स रॉयस बंद हो जाएगी, ऐसा नहीं होता. Right? There is a market for everything, because bariatric surgery is primarily for people who are suffering with class 3 obesity and diabetes. So it is here to stay. So people or surgeons planning to become bariatric surgeons, it's not that in the next 10 years it's going to finish. No, that's not going to finish. It is here going to be staying. And as far as robotic is concerned, robotic surgery is also going to stay. And I think it is the future of surgery. And आजकल जितनी भी surgeries हो रही हैं, almost all surgeries can be done robotically. And it has surely got better outcomes, less pain, early return to work, less strain for the surgeon too. And of course, at this point of time, it's slightly more expensive. But over a period of time, I think the expense will come down, and more of artificial intelligence and more of semi-operating consoles will come. So it is going to stay, and it is absolutely going to be a brilliant future for surgery.
And one last message for the patients who are watching this podcast. So, like, who are actually on their journey of weight loss.
So, if you already had your surgery, please stick to your surgeon and dietitian. My only message to you is, please do a regular follow-up. How long? Lifelong. Please be regular with your dietitian and surgeon, so that you are under a watchful cover. Your nutritional profile is done. If you have been suggested certain supplementations, please take that regularly. Do regular exercise. Don't cheat. Don't get into alcoholism. No smoking. No drugs. If you are thinking of getting a surgery done, research about the surgeon, talk to them, talk to the surgeon about your fear of surgery. आप उससे ज़रूर जाके बोलिए कि आपको सर्जरी से डर क्यों लगता है. आप ज़रूर पूछें कि what to expect after the surgery, what results to expect after the surgery, and what is the life like after the surgery. If possible, do talk to a few patients जिनकी ये सर्जरी पहले हो चुकी है, और अगर आप उनसे बात करेंगे तो आपको आसान लगेगा कि उनकी जर्नी से आप कुछ पॉइंट्स, इंपॉर्टेंट पॉइंट्स पिकअप कर सकते हैं. So this is all my suggestion to you. Talk to the surgeon, talk to a few patients before taking this step. And if you've already got it done, please stick to your surgeon and your dietitian.